Welcome to Chapter 24, Part 1, Microbial Diseases of the Respiratory System. This chapter fulfills objective number 4. Now in this chapter, the book breaks it down into bacterial, virus, and fungal causes of diseases of the upper respiratory system. Then they do the same thing in the lower respiratory tract. I prefer to start out at the top of the respiratory tract and move down to the bottom, and I'm going to mix bacterial, viral, and fungal pathogens in amongst each other. So in other words, this is going to have more of an anatomy flow versus talking about the different groups. So in part 1, we're going to talk about the structure and function of the respiratory system. Then we're going to cover the common cold, Streptococcal Pharyngitis or strep throat, diphtheria, and pertussis. In part 2, we're going to talk about respiratory syncytial virus, influenza, tuberculosis, the fungal causes of lower respiratory disease, pneumococcal pneumonia, and Legionella oocysts. Now, the main function of the respiratory system is gas exchange with the blood, taking oxygen out of the air, putting it into the blood. Then when the blood brings CO2 from the tissues, that goes into the respiratory system and back out. Now you have two main parts of the respiratory system. You have the upper respiratory system, like we have in the picture here, and you have the lower respiratory system. Let's talk about the upper respiratory system. The upper respiratory system consists of the sinuses and the nasal cavity. The oral cavity is oftentimes considered to be part of the upper respiratory system, and you have the throat or pharynx, and then you have the larynx or the voice box. Part of the function of the upper respiratory system is to warm up the air and humidify it before it hits the lungs. Also, your sinuses function in removing dust and other particles. You have a lot of mucus, it's very sticky. Hopefully you get rid of pathogens. Now the pharynx is not only a part of your respiratory system, but it's also part of your digestive system. Stuff that goes into your mouth goes down the pharynx, then it splits off into the trachea or windpipe or into the esophagus where it goes into the digestive system. Now the upper respiratory system does have normal flora. Usually it's very similar to the normal flora of your skin. A lot of staph, a lot of strep, but you also have lots of other microbiota because it's wetter. It's wetter. The mucus provides nutrients for the bacteria and the other organisms. In a healthy individual, not considered a problem. Now, your lower respiratory system, that's from the trachea on down. Your trachea goes down into your bronchioles, and they split off into smaller and smaller until you get to the end where you have little sacs called alveoli. And that's where the actual gas exchange happens. That's where you have capillaries that exchange gases with the air in your alveoli. Now, your lower respiratory system should be free of normal microflora. You produce mucus in your lower respiratory tract, and it's moved up by your ciliated cells, moved up and out. So you shouldn't have any normal flora in your lungs. If you get large numbers of bacteria or viruses or fungi living in there for long periods, then it causes disease. You can get bacteria and what have you in there temporarily, but it's usually not a problem unless they stay there and they multiply. Now, starting at the top of the respiratory system, let's talk about the common cold. You've all had common colds. You know the symptoms. In an uncomplicated common cold, you have sneezing, excess mucus production that we call a runny nose, and watery eyes. Now, common colds can spread from there, go from being uncomplicated to being complicated. It can spread to the ears, causing ear infections. It can spread down into the throat, causing a sore throat, laryngitis, and in some cases it can even move into the bronchia, causing bronchitis. But for most of us, we experience a very mild, annoying disease. Now, most common colds are caused by rhinoviruses. They're called rhinoviruses because rhino stands for nose. So a rhinoceros is an animal that has a horn on his nose. So a rhinovirus is a virus that was first isolated from the nose. And they cause mainly head colds. That's where it stays uncomplicated, stays in the head, does not cause sore throat or cough. Coronaviruses are also important. They're less common causes of the common cold than the rhinovirus, but they cause between 10 to 20%. Now, the picture here is of an adenovirus. Now, you can tell from the name that it was first isolated from somebody's adenoids. And this also causes the common cold, but it's more likely to spread into the bronchia and cause bronchitis. So, you've all heard the old saying, we can send a man to the moon, but we can't cure the common cold. Well, it's true. We can't cure it. Part of it is because it's such a mild disease, there hasn't been a big push of donating research money to curing the common cold. Doesn't kill very many people, and it doesn't cause a whole lot of loss of productivity. The other thing is there's over 200 kinds of viruses that cause the common cold. Most of them are different serotypes of your rhinovirus or your coronavirus. What do we mean by a serotype? It means that the antigens on the surface of the different types of, say, a rhinovirus are different enough that after you've gotten over one type of rhinovirus and you've built IgA immunity to it, when the next serotype comes by, it's different enough, even though it's still a rhinovirus, that your immune system doesn't recognize it. Kind of sounds like influenza, huh? But with influenza, they're actively changing their antigens, whereas this is kind of like a huge family with lots of cousins, and all the cousins don't necessarily look alike. So, that's why we can't cure the common cold. Now, as far as treatment, mainly it's preventative. During cold season, wash your hands a lot. We've found that although you can get the common cold from somebody sneezing nearby you through respiratory route, we've found that most people pick up common colds through direct contact or through indirect contact through fomites. So in other words, somebody sneezes, they wipe their nose, they go and shake hands with you, or they touch a doorknob. You touch the doorknob, you rub your eye, and you've inoculated it into your sinuses. Okay, so hand washing is a big way to prevent the common cold. Once you've got the common cold, is supportive measures. Get plenty of rest, get plenty of fluids. Zinc has been found to decrease the duration of the common cold, has not been found to cure it, but it decreases the duration. And you have to just live with it. Now moving down the respiratory tract from the sinuses into the throat or the pharynx. Inflammation of the pharynx is called pharyngitis. Most people, when they get pharyngitis, it's caused by group A Streptococcus. Generally speaking, it's Streptococcus pyogenes. So we have a tendency to call it, that's right, strep throat. Now, strep is a normal component of most people's throat microbiota. And you can get it from if you're stressed or you haven't been getting enough sleep, you're malnourished. Anything that's going to decrease your immune system is going to cause these opportunistic pathogens to take that opportunity to multiply, and your immune system recognizes it and you get inflammation of your throat, pharyngitis. Now, that's not the only way that you can get strep throat. If somebody already has strep throat and they cough or breathe on you, you can pick up high numbers of Streptococcus, and that's the same effect as if your immune system was depressed. You have large numbers of this opportunistic pathogen and you develop strep throat. That's why it passes from person to person during certain times of the year when we're in close contact with each other. Now, treatment. Streptococcal pharyngitis will clear up on its own. The reason why we treat it with antibiotics is to shorten the duration. because if we shorten the duration, you're less likely to get complications. Streptococcus pyogenes can spread to the blood system and create scarlet fever. We talked about that in a previous chapter. From there, if the proteins on your heart look similar to the M protein on the streptococcus, your immune system can attack your heart, causing rheumatic fever. So we treat streptococcal pharyngitis with antibiotics to decrease spread and to limit complications. On to diphtheria. Diphtheria is caused by gram-positive rods. You can see from the picture here that they're gram-positive. They're rods most of the time. We call them pleliomorphic because if you look, you can see they've got swelling on the end. Some of them look like cocci. They are non-spore forming, but that sure looks like there's a spore on the end of those. They also divide in an unusual way by snapping binary fissions so that when they divide, they get a little bit of the cell wall between the two new cells that hangs on. So you get these V shapes that are very characteristic. Also, these V's can collapse into the bacilli lining up like this. We call it palisade arrangement. That's typical for Corynebacterium diphtheriae. Now, up until 1935, when the vaccine became into general circulation, diphtheria was one of the most common causes of childhood mortality. So diphtheria is not to be trifled with. It starts with a sore throat and fever, progresses to malaise, you just don't feel good, and swelling of the neck. Now, if the Corynebacterium diphtheriae has the genetics for an exotoxin, you can also get a pseudomembrane. See on this patient here, we've got a membrane that forms across the throat. It's composed of fibrinogen, that's the protein that causes blood clots, dead white blood cells, dead epithelial cells, and bacteria multiplying. It's vascularized. You have blood vessels in it. So you can't go in and cut it out without causing hemorrhage of your patient. Now, this membrane for which diphtheria was named, diphtheria comes from the Latin for leather. This membrane can cut off the airway, and that can be one of the causes of death of the children. Now, because this more severe form is caused by an exotoxin, how can we prevent it? That's right, with a toxoid vaccine. The toxoid vaccine for diphtheria is administered along with other toxoid vaccines. It's generally combined with your tetanus vaccine, and you have immunity to the C. diphtheriae. Now let's move into the lower respiratory system. Pertussis, or whooping cough, is caused by Bordetella pertussis, which is a small aerobic gram-negative coccobacilli. So because it's obligately aerobic, you can understand why it likes to hang out in the bronchia where there's lots of oxygen going past them. They attach preferentially to the cilia of the ciliated cells of your bronchia. And first they attach and release a toxin that inhibits the movement of the cilia, then they proceed to kill the ciliated cells. This impedes the flow of mucus up the cilia escalator, up and out, and leads to coughing. Now, pertussis comes in two stages. You have the first stage, which is very similar to the common cold. Then you move into the second stage where you get the severe coughing, where we get the term whooping cough from. In some cases, the coughing is so severe that the child breaks their ribs. It's not good. Smaller children, because they have a harder time coughing, they get the classic whoop. They cough, cough, cough. The severe intake of breath, and that's generally where you get the whoop of the whooping cough. And then you go into the convalescent stage where you're rebuilding your ciliated cells, and so the cough even when it's not in the most severe stage, can linger for months. Now, once the vaccine, it's a whole cell killed vaccine, inactivated vaccine, decreased the amount of pertussis significantly. We have had sporadic outbreaks. Personally, I'm blaming the tying of vaccines to autism. Because it seems to be about the same time that we started having these outbreaks of pertussis. Speaking of which, we're currently in the middle of an outbreak in Idaho, so make sure that you vaccinate your kids, and if you're an adult, go get your boosters, because as an adult you can get pertussis and it will last for months, and it can lead to asthma because of the damage to those ciliated cells, leading to complications with your bronchia. So, also not a disease to mess with. Now, what can we do for treatment? You can use antibiotics because it's a gram-negative cell. We generally don't use cell wall inhibiting antibiotics. Tetracycline has been a big favorite. It inhibits protein synthesis, broad spectrum, but you have to be very careful with children who are young enough that their teeth are still developing. Otherwise, you get the side effect of darkened teeth. Of course, that's a whole lot better than dying, so we have been known to prescribe tetracycline even when we know it's going to lead to darkening of the teeth. Well, that's it for part 1. Get up, stretch, take a break, and come back for part 2.